My name is Warren Limmer. I'm the chairman of the Judiciary and Criminal Law Committee. We also have a finance responsibility as well in this area. And for the record, this is January 11th, 2021. And today's agenda will be to review the Minnesota Department of Corrections COVID-19 impact report. As you know, COVID-19 has dominated all of our attention over this last year, and nowhere where it is as important as in our prison system and how it affects and challenges the responsibilities of our state regarding the safety of inmates as well as our staff. And today we will be listening to Commissioner Paul Schnell and perhaps some of his staff members if they need to answer technical questions. Before we begin, I would just like to welcome everyone back to a 2021 session. And we will be going through introductions. And I know that we do not have all of our members on board. However, we will not be having votes on this committee hearing today, so a quorum is not necessary for us to listen to the challenges that our Department of Corrections has gone through this past year. I think it's vitally important for us to focus this very first meeting on COVID-19 and how it affects our department. It's, in my opinion, the most immediate concern that we should have, and focus on the safety of all those who are involved in that agency. I think I'd like to start out. We have a few new members today, and I think I'll start out. Senator Bingham, you've been lobbying me for a few years on what your anxious desire to be on a committee like this, and so yes. I know that you have a record of being there from that other chamber, and why don't you give a quick introduction and then we'll move on to Senator Kiffmeyer.
Sounds good. Yeah, Mr. Chair, thank you. And I am super, super excited. And I might be an anomaly out of the 67 of us to really want to be on this committee. It's a number one top priority for me. It's exciting, and I couldn't be happier that I'm having the honor to be on the committee. So thank you. And I look forward to learning from all of you. And I represent Senate District 54, which is Cottage Grove, Hastings, South St. Paul, Afton, and all the surrounding communities that way. By background, I'm a paralegal by trade, and also an adjunct professor at Winona State. So I also spent some time as a Washington County commissioner. And so a lot of this stuff also kind of stems from that, my experience there. But most of my experience as a paralegal is with the Hennepin County Attorney's Office. And so hopefully I can bring some insight into there. I focused on property crimes for most of it, and then child protection on the other side. So on the other time of my tenure there at Hennepin County. So thank you, Mr. Chair.
Well, welcome on board, Senator Bingham. Senator Kiffmeyer. And then we'll follow up with Senator Matthews after Senator Kiffmeyer. Please unmute your system, Senator.
Thank you, Mr. Chair. Glad to be with you today and on the Judiciary Committee. It is a new committee for me, never having served on Judiciary in either the House or in the Senate. But I've always thought that it was a fascinating committee with the subjects that come before it. And I like to stretch a little bit and delve into areas that are maybe a little less familiar to me. So not totally unfamiliar. I've been before your committee. I've dealt with things in the matter that do come before your committee. So I'm glad to be there. Just of information. I represent Senate District 30, which is all of Big Lake, Elk River, Otsego, Albertville, St. Michael, Hanover, and 14 homes in Dayton. That's Eastern. They matter. They care. That is mainly the eastern portion of Sherburne and Wright County, including the Outlet Mall, which I'm very happy to do constituent services at frequently. Thank you, Mr. Chair. Glad to be with you.
Thank you, Senator Kiffmeyer. For the record, we do have quorum, Senator Matthews.
Thank you, Mr. Chair. I will let Senator Bigham and the rest of the committee know she's not the only one who wanted and asked for being on Judiciary. I'm glad to join her in that. Apparently, your committee attracts interesting folks that want to serve on it, Senator Limmer. But I am looking forward to it. And 10 years ago, I had the privilege of paging your committee. And it's exciting for me now, 10 years later, to be a member of it and to work for protecting our courts and judicial systems and all the work that we do in this committee. So I'm ready to dust off the few things I remember from years ago and get up to speed with the rest of you. And I'm looking forward to working with you. I am representing Senate District 15. My hometown is Princeton, about an hour north of the cities, and my district is all or parts of 6 different counties, all of Mille Lacs County, large pieces of Sherburne and Benton County, and portions of Kanabec, Morrison, and Wright counties go from Becker and Clearwater up to Lake Mille Lacs. So I am excited to be here and looking forward to it. Thank you, Mr. Chair.
Thank you, Senator Matthews. Senator Ingebrigtsen, you were on the committee last year and you've decided to stay on board.
Well, yeah, you know, I got me on a weekday when we were arm wrestling and you beat me. And so, no, I've actually enjoyed it. I was on it for a while, as you know, off, I think, maybe for 1 term, and now I'm back. My concerns, of course, are, it would be no surprise to anybody, is the law enforcement issues, as well as criminal law portion of judiciary. But folks, I look forward to working with all the new members and the old ones alike, and the new staff, and my background, I guess everybody knows that, like Mr. Schnell that's on here, law enforcement background, career in law enforcement, and it's always been a part of my life, and hopefully I can be of some use.
All right.
All right.
Thank you. Senator Mark Johnson.
Well, greetings. Sorry for coming on late here. I saw my schedule, it said G15, and liking the in-person meeting more than the Zoom, I wandered over there and realized that this is a Zoom only. So I apologize about being late, but thank you for the opportunity to be on the committee. I'm excited to hold the vice chair position. I'm kind of sorry for having to retire Dan Hall to do that, but you know, he was an excellent vice chair, and I'm honored to have this spot. So thank you for that opportunity. Now, I came in a little bit late. Is there anything, Senator Limmer, that you want me to cover?
No, we're just doing basic introductions. Why don't you tell the audience where you or who you represent? Sure.
Well, I represent Minnesotans of the Northwest. So I've got Northwest Minnesota. I border on Manitoba and North Dakota. Got a relatively large district up there. It covers 6 counties. So that's my neck of the woods. It's probably the farthest drive. I'm the only senator that has to drive an hour in another state to get down to our state capital. But that's just because of the convenience of the roads up there. But yeah, so that's my neck of the woods. I have Thief River and Hallock and Lake of the Woods. I border right on that and some other communities. So yeah, great to be here.
All right. Next on the list is Senator Pappas.
Hello, good afternoon, everyone. I'm Senator Sandy Pappas from St. Paul. I represent downtown St. Paul and communities to the west and the north and the south within the city of St. Paul. I've been on the committee for the last session since 2016. Hadn't served on judiciary since I was in the House in the 80s, so it was good to be back. And my primary interest is criminal justice reform.
Great, thank you. Senator Bruce Anderson.
Good morning, members. Good morning, I should say good afternoon. My name is Bruce Anderson. I represent most of Wright County and a little bit of Hennepin County and this is my second go around on public safety. I guess I was in a weak moment when I reassigned my name onto the docket here, but looking forward to helping out with public safety issues and especially the budgets coming forward as we look to balance our budget in 2021 and 2022 and 2023. So thank you for the opportunity to be on board.
Thank you, Bruce. And last but not least, Senator Ron Latz, who is also our ranking minority member. Ron, welcome back.
Thank you. Good afternoon, everyone. Welcome to the new members on the committee. It's always good to get new perspectives. It helps the deliberative process. I represent St. Louis Park, Hopkins, Golden Valley, Medicine Lake, and Plymouth, 5 communities in the western suburbs of the Twin Cities. I've served in the Senate before that, in the House before that, on the St. Louis Park City Council for 9 years. So I'm pretty rooted in the communities that I grew up in and served on the local level as well. I should ask the host to change the name on my screen. I've tried to do it and it won't allow me to. It's a leftover from an earlier Zoom court appearance I had today. But I guess that reflects my other hat. I'm a private attorney at my own law practice, as well as serving in the legislature. I would like to note that it's my hope that the committee this spring will take a proactive and serious effort to address substantial societal problems within the area of maintaining community safety. I believe this effort needs to be beyond the box of traditional responses to this committee, and needs to happen promptly, because ignoring the problems will simply allow them to fester further and eventually explode, or should I say explode again. While there are no simple answers to these complex matters, we can and should take steps this session. To ignore them would be malpractice, in my view. So I look forward to working with this committee and others to take those steps and on the other serious issues that come before the committee.
All right. Thank you, Senator Latz. Greatly appreciated. In that same regard, I may suggest that similar to other years, at the end of the trail, at the end of the session, we're always dealing and negotiating in a much tighter arrangement with the House in the conference process. I actually would like to get back to the formalization of conference committees, but we've seemed to have slided a little bit away from that, especially during the timely demands that we saw during the special sessions during the summer. And I just think it's good to go back to the way government is supposed to be run, and that's with full disclosure and open meetings when it comes to conference committees. And so I'm hoping to do that. And in that same regard, if we can avoid conflict toward the end, this is just a message out to the governor's administration. If they see something in a bill that we are interested in, something that we would like to advance, and if there's something in it that they see as an addition or a concern, we would like to have that known to us, the governor's concerns, as early as possible, rather than at the end of the trail when there's a lot of, things get very complex toward the end. Just a friendly invitation. Having said that, I will have to admit I am very inexperienced on hosting a Zoom meeting, especially in the confines of a Judiciary Committee hearing. But we're going to try to do the best, and I just wanted to offer some tips that our staff has suggested that would make things run a little smoother. First, we have emailed all of our staff and all of our members with their committee packets this morning, and that contains all of the material for today's meeting. This will be a normal practice, so keep an eye on your emails. Be prepared by opening or printing these documents for their use during our committee hearing. And also, all documents that we post to the committee members are also on our committee meeting notice for the viewing public. The Senate is attempting to create some uniformity for Zoom hearings. Each committee has their own Zoom account, and the settings are preset for more professionalism and safety purposes. Please make sure your audio is on mute until you're ready to speak. And a helpful tip, if you press and hold the space key, you can temporarily unmute yourself. Also, just as a courtesy, members, would you please keep your video on, even if you aren't speaking, unless you need to step away for a bit. Testifiers are here to speak directly to us. And I just think it's common courtesy if we could keep our video on so that they know that we're around and actually listening to them. Members, please use your raise hand feature if you'd like to speak. And our CLA will consistently monitor this function, and I will too. The group chat feature has been disabled, but you're still able to send the host, that would be Angela, a private chat at any time. And to minimize any technical glitches, plug in your computer, your laptop computer if you're using it when using Zoom. Otherwise, sometimes we may lose you due to a lack of power. Today, we're hearing from the Minnesota Department of Corrections, who will give a COVID-19 impact report. But before we do that, we also have staff that I'd like to have introduce themselves at this first meeting of our judiciary. We have a new CLA, Committee Legislative Assistant, Sage Petrusa. Sage, are you on board? If you could.
I'm here.
We have a dark silhouette of you with the light in the background. So, but nevertheless, why don't you give just a brief background to our committee?
I went to Kansas State and graduated in marketing, and then worked on some campaigns, and now I'm here.
All right. That's kind of the path of a lot of legislative assistants. Linnea Michelson.
Hi, I'm Linnea Michelson with Senate Republican Research, and this is going to be my 16th session, vast majority of it with you, Mr. Chairman, as well as several of the other members of our committee. Thank you.
You poor person. Jackie Clinton, are you on? There she is.
Hi, Mr. Chair. Jackie Clinton, Senate DFL Research. This is my 7th session, and I believe my 3rd with Judiciary.
All right, great. And Senator, I almost called him a senator, Mr. Ken Backus.
Hi, Mr. Chair, members. Ken Backus here, Senate Council. This is my 27th session, and I'm happy to be back with all of you.
And then we also have Chris Turner somewhere on the screen.
Hello, Mr. Chairman and members. Chris Turner, Committee Fiscal Analyst. It's my 31st session and my 27th session partnering with Ken.
What was Thomas Jefferson really like, Mr. Turner? All right.
Yeah.
I think we covered, Angela Cook. I almost forgot. Angela, why don't you introduce yourself?
My name is Angela Cook, and I am the committee administrator for this committee.
All right. Almost forgot Angela, and I never would have heard the end of it, I'm sure. We're going to move right on to the Department of Corrections. And members, if you could hold your questions until after their presentation, that would be helpful. We have Commissioner Paul Schnell before us. Commissioner, welcome to the committee. Would you identify yourself for the record?
Yes, good afternoon, Mr. Chair and committee members. Paul Schnell, Commissioner of Corrections. I want to just first of all say it's good to see you all and welcome the new members. Great opportunity to have the chance to talk to you today. It's strange to do it in this way. It would be much easier in person, and I look forward, as we all do, welcoming that day. I'm going to share the screen here and walk through some things as quickly as we can, and to give a sense of where things are at. Hopefully you can see that now.
We can.
Good. All right. So I'm just going to give a very brief background on the agency and then dive right into the COVID response, which was our assignment. And I know that several of you have submitted some questions beforehand. I can tell you that we worked over the last about the first year and a half since coming on in January of 19 of working on our mission. And that really has been focused on this notion of transforming lives. We know that, 95% of the people that come into the Department of Corrections will end up going out to communities across our state. And as a result of that, we want to make sure that we're investing in making sure they go out better, far better than when they came in. And we really want to do that by achieving justice through really addressing the issues of racial equity, restoring the harm that has been caused, and deepening and growing community connections, which we know ultimately helps people be successful over the long haul. I just want to give you a really quick glimpse of the agency by the numbers. The DOC has about 4,300 employees. We operate 10 prisons across the state, and we'll give you a little glimpse of that in a second. 17 state district field supervision offices, probation officers. We supervise about 20,000 individuals on community supervision, either probation or supervised release across the state. And our budget is just about $624 million annually. When we look at the numbers, pre-COVID, our numbers were plus or minus 9,200 people in our prisons. And then I give you a little bit of a breakdown here as we look at March 2020 at 8,800, down to 7,958 on July 1, and presently at 7,325. One of the things that a lot of people don't know is when we think about the number of people that are transitioning through the Department of Corrections and back into the community, on a typical month, we release about 600 people from our state prisons. And so you can see there's a dramatic number of people that are going out and in many cases coming in, which ultimately we want to try and reduce. This just gives you a sense of our facilities across the system. These facilities age and range from more than 120 years old to 21 years. And at this point, given the age of many of our facilities, we're appreciative of the asset preservation funds that have been allotted to the agency to really help us improve the conditions at these state resources. In general, these facilities really run the gamut. We have one women's facility. And if you look at Togo in particular and MCF Willow River, those facilities are right now the boot camp facilities, the challenge incarceration program. Our most secure facility is MCF Oak Park Heights, which what we would call a level 5 facility, then followed by close custody, which really operates out of Stillwater and Rush City and St. Cloud, and then medium custody facilities at Moose Lake, Faribault, Lino, kind of rounded out. So that gives you just a sense, and you can get provided a sense of the population at each of those facilities. When we want to talk just briefly about what the obligations of the DOC as an agency, we have an obligation, and Chair Lemmer frequently references this, our constitutional obligation to provide for the health care of those who are incarcerated in our facility, and that includes things like substance use disorder, sex offender treatment. We also provide mental health and behavioral health programming and a range of rehabilitative programs. We also provide transitional planning and other reentry services for people that are leaving our facilities and going out into the community. We have a robust education program. Minnesota is really, I think, blessed with this. And really, this is an important feature. We know that when people achieve higher levels of education, whether that's just having their high school diploma or a GED, their chances of success improve dramatically. We approve Community Corrections Act county comprehensive plans and oversee pass-through to those CCA counties as well as county probation offices across the state in those counties. And we provide supervision services, as I mentioned earlier, in a variety of states, community counties across the state. I should point out that that when we think about probation and supervision services, we really have a bifurcated, a trifurcated, actually delivery, probation and supervision delivery system in our state. Something that at some point in time may be worth a conversation, but that is the DOC providing that. It could be in Community Corrections Act, where those counties provide the full range of supervision, both of those people coming out of prison as well as probationers. And then the county probation office model, where in those counties, it's mostly misdemeanor, gross misdemeanor level supervision and some pretrial supervision as well. With that, I'm going to go right into the DOC's COVID response and just give you, from a high level perspective, these are the things that ultimately the components, the elements of the DOC's response. Planning and population management, and I'll talk a little bit about these things as we go through. Early on in the pandemic, we implemented what was known here as IMT, or an incident, or we established an incident management team. Incident management team really was set up in such a way that there is a group of people, like for instance, our health services director, Nan Larson, who's with me here at the office, was involved in that, and some other staff began the process of talking through how it was we were going to manage this. And the objective of the incident management team is to take direction from the leadership, the executive leadership intent as we go forward, and then to work that across the agency. Ultimately, we focused heavily on how we're going to manage our population during the crisis, knowing that social distancing was a key and critical component to managing the introduction and spread of COVID within our facilities. I'll talk a little bit as we get into this later on, but we implemented some modified programming options to try and do some level of creating population capacity early on in the pandemic. And those numbers, which we'll cover in a bit, helped us manage our population a bit in the early days. And over the course of time, the fact that the courts have been not hearing these cases on a regular basis right now has really resulted in a reduction of our numbers overall. In addition, we've done some modification of looking at how we manage the return of release violators and working with the counties to find strategies to address their needs in the community. Second element of this was really hygiene and personal protective equipment. The agency we engaged a variety of our staff in looking at that, all of the ways hand washing stations were brought in very early on. Hand sanitizing stations were brought in. The use of sprayers and cleaning solutions to address areas that were more commonplace, like the phones or some of the exercise equipment in some of those areas, the tables where in the flag area are common areas where people in our facilities come together. So those things were important, along with the fact that we established a robust personal protective equipment strategy that included having our MinCore Industries manufacture and create early days barrier masks for our agencies and some others along the way. And over the course of time, those processes have continued. They've done things like created shields, developed and manufactured gowns for use when higher levels of personal protective equipment were necessary. They have been instrumental in helping us with this response. We'll talk more about PPE in a bit. We established quarantine and isolation along with the provision of medical care. You know that having a robust quarantine status is really one of the ways to manage spread, and isolation strategies for those people that early on we suspected or demonstrated some signs or symptoms of COVID. Now, more lately, as we've conducted robust testing within our facilities, it has been helpful to have those. And we'll talk a little bit about some of the challenges we saw along the way with isolation, especially with some of our larger outbreaks. We, from the beginning, were really heavily engaged with our health services unit. Our medical director, Dr. Jim Amsterdam, was and has been instrumental in working with, coordinating with the Department of Health and following all of the guidance from the CDC around the ways in which we could protect and manage COVID throughout the course of this pandemic. Health screening and comprehensive testing was another element of this. Early on, before testing was readily available, we implemented health screening protocols at all of our facilities, and those protocols looked at staff who we knew ultimately would be probably the carriers of a lot of this, because we were quarantining people as they came into the DOC. We, as you may know, we centralize intake processes. For men, they come in through the St. Cloud facility, and for women, they come in through the Shakopee facility and remain there. And ultimately, there was quarantine protocols put in place. Early on, we also did things like making sure that we kept the incarcerated people within and among their units so that there was not that opportunity for things to be spreading across the facility. We also looked at and over the course of time have developed one of the most robust comprehensive testing strategies in the country. I'm really proud of this, and I think our state deserves and should take credit for this. Ultimately, comprehensive testing is one of the ways that we stay on top of this. We better manage this, both for our staff as well as for the people in our care, custody, and control. And I think it has been essential to helping us manage this. We certainly have learned a lot from our comprehensive sentinel testing strategy. I would say that, you know, across the states, Minnesota has been a leader in this area, and I think we've learned a lot as a result of that. We've done a considerable amount with program modification and communication. We've closed visitation very early on, again, looking to minimize the risk of introduction and spread of COVID, and yet recognizing that how challenging this would be, given the fact that we know visitation is so important, and it's one of the things that actually reduces risk factors for people that are in our prisons. Ultimately, we really stepped up our communication, trying to find ways to increase that. We, each of the facilities have resident councils where the men and women in custody have representatives that meet with the warden and their teams. They began providing information. We did videos out to the folks in DOC custody, wanting to make sure that they had information about COVID and the reality that we had to modify our programs. And in some cases, even modified lockdowns as we saw larger scale outbreaks across our facilities. And then finally, I would just say that we really focus heavily on information and management and sharing of that information. We wanted to make sure that we were, as we implemented new strategies and we saw what worked and what didn't work, that we were communicating that, and that incident management team was critical to that. We also wanted to make sure that we accessed CARES Act funds to help us address some of our needs. We implemented early on through a negotiation with our phone system provider that each person in our in DOC custody would be able to access to free 5-minute phone calls per week, knowing how important it is that we have those contacts with people in the community are critical to their transition. We were actively and heavily engaged on a near daily basis with the Department of Health, who has been so immensely helpful throughout the course of this crisis, and they continue to be helpful. And then addressing and ensuring that we were cognizant of how we would manage and share information, even things like medical information from our staff, test results, for instance, positive test results, or people in our population. So these things have been important as we go through. And so I provide this really as a high level, and if there are questions as we go forward, I certainly want to be able to answer them. I think this just gives you a sense of some of the gowns and some of the equipment that was manufactured by MNCOR over the course of time. The hand washing station were temporarily brought in or in the early stages. Since that time, we have, in some cases, actually established more permanent hand washing station. The belief here was what were some of the things that we could implement that if they were good for a pandemic, they might be good going forward. And this was one of the areas that we felt that good hygiene practices are so important. Again, this just shows you that inside MNCOR, there was a lot of manufacturing. There were people sewing and making shields and masks, and how important these folks were, not just to the Department of Corrections, but in many cases, the halfway houses that we worked with. I believe we provided some personal protective equipment in the early days to our counterparts at the Minnesota Department of Human Services and Direct Care and Treatment. So these, in our industry program really was and has been and continues to be very important in terms of our COVID response. Even the plastic shields were manufactured as part of these processes for our visiting areas, intake areas, and legal visitation rooms where that could be accommodated. We utilize, as I said, this whole notion of really heavily emphasis on isolation. We wanted to be able for those people who were experiencing symptoms or tested positive to separate them from the population as quickly as we could. Each facility identified areas within their facilities where that could be managed and maintained. And then we wanted to make sure that we continued our robust medical care and made sure that as issues that were COVID related came up, that we wanted to be able to respond to them quickly. In the early stages, we discontinued co-pays, medical co-pays by co-pays in the DOC are about $5 per medical visit, which you can imagine for some of our people is very challenging. The last thing we wanted to have people doing was not reporting health status or symptoms because of the economics, because the implications for our staff and for the others in the population are simply too significant. And so early on we did that. We have since modified that, and we still do not charge the copay if the medical complaint is COVID-related symptoms. Our testing strategy, as I mentioned, we have a testing team that goes out. They will go to each of the facilities. They provide testing. They observe the testing and organize the testing materials and personally witness and show the people who are doing the test how the tests get administered, and then they label each of those samples for submission to the appropriate lab. You can see just one of the areas here where we're doing things that are greatly distanced to try and make sure that we're providing programming to the fullest extent possible. And the use of ITV for court proceedings and other types of hearings has been essential. And one of the things that I think has been really important to sheriffs across the state, this has reduced transportation costs dramatically, and we believe is something that we've developed a level of skill and proficiency with that we believe needs to and should continue for the reduction of cost and for maximizing efficiency to the extent that courts are willing to accommodate this going forward. But it has been really key and critical. The other thing I would just say is that one of the things that I'm really proud of that our staff worked on was developing this comprehensive dashboard for COVID-19 that covers everything, our testing, the number of deaths that have happened unfortunately in our system, the rates of positivity throughout the system. And this website is updated on a 5 days a week basis. It is about 24 hours behind in terms of the data because we're continuously receiving, for instance, test results throughout the day. It addresses things like COVID-related release programs, as well as positivity rates throughout the system at each facility, as well as staff positivity rates throughout the system. And certainly something that our staff did a remarkable job developing and putting together and maintaining, which has been important to system stakeholders throughout the pandemic. As I mentioned, we did have some COVID release programs to help us with our population management early on. These COVID release programs are really otherwise statutorily authorized programs that were modified to the COVID environment, and specifically in two areas was COVID work release. Work release is a long-standing, has been around for decades and decades, and something that we use at any given time between 200 and 300 people on our work release status across our state. And what work releases do is they get moved out to halfway houses or county jails or other settings in some instances, and work from there in terms of reintegration with families, their communities, and begin the process of looking for work. That was expanded with people who were looking at 90 days or less, were deemed in that a low risk category, and had a place to go in the community where they could be monitored. Second program was the COVID conditional medical release. Conditional medical release is a statutorily approved program, generally speaking used for those people who are suffering from ailments, medical ailments that are likely in most cases will become fatal. And that might mean people in hospice level care, as for instance, would be a common use of a conditional medical release. In this instance, we looked at the medical assessment that was provided by DOC medical providers. Then we looked at all of the public safety components that are required by the statute. And we assessed, we received about 2,800 applications for conditional medical release. And I think to date about 100, just shy of 160 have been approved, and those people have been out into the community. As I mentioned earlier, we started this release violator management strategy and working with our county partners or our probation, the DOC probation officers across the state, and working to try and find resources to manage violators in the community. And ultimately, that has helped in terms of the reduction. At any given time, about 11% of our population is made up of release violators, and about 13 to 14%, and this was pre-COVID, of our population is probation violators, people who are committed to prison. So about 25% of our population are people who have been released, either they were on court-approved probation and the court ultimately sent them back, or they were on supervised release status, that 1/3 of their prison term, their overall sentence. and they were revoked and brought back into the facility. And it's one of the areas that we think is a place that we can make a big difference going forward. To date, about 320 incarcerated people were granted early release through these COVID release programs. I'm going to just highlight over these, and we'll come back to them if you have questions. But these will just give you a sense of COVID, COVID coronavirus relief fund requests, and the total of about $19 million overall. These funds were immensely helpful, and we'll talk more about them as we go forward. One of the questions that came up was how were these funds used? Those funds were largely used for things like staffing. One of the challenges that we faced, that many state agencies faced, was COVID-related illnesses, or those people who were immensely high risk. And our staffing challenges that we faced resulted in need for overtime. During some of our outbreaks, we actually moved people from other parts of the Department of Corrections to come in and cover staffing, for instance, up at Moose Lake. We purchased PPE, a lot of PPE over the course of time, additional medical supplies that were brought in during the course of this, cleaning supplies, even the rental of those hand washing stations early on. Because food distribution was oftentimes modified to the point where we could not use our dining rooms in full because of social distancing concerns. Ultimately, food service and food delivery was done at the cell or in the units. And that meant that our food distribution supplies, in fact, our food costs went up during the course of COVID because of that. Required additional equipment so that we could get food distributed to the housing units in a timely fashion. Staff testing was also covered by the CRF funds, as well as paid COVID leave. Some of the supervision services and programming services that we utilized, things specifically like batter interventions programs. We wanted to make sure that we were addressing those needs. And so we worked with crime victim advocacy. We worked with the counties to help us manage the supervisions of some of those 300 people that were released. We conducted air quality studies and some equipment that related to that in our facilities. One of the things many of you will be familiar with is the fact that we had a large outbreak at Stillwater early on in November. That facility went for 5 months without a single positive test. And in late October, early November, we went from 0 ultimately to 900 positives in that facility, 900 plus over the course of about 4 weeks. And so one of the things that we asked the question was what changed? And the key thing that changed during the course of that was activation of the heating system. Again, this just gives you a sense of our supplies. We were fortunate early on to have a supply. The DOC does have a comprehensive plan for pandemic response. But I will tell you that nothing tests a pandemic response plan like a pandemic. And so we learned a lot through the course of this, but we were fortunate to have a supply of some of this equipment early on. Right now, changeouts of PPE are done on a 4-day rotation if they have N95s, the highest level masks. Surgical masks are changed on a daily basis. And sometimes more often if they are damaged or soiled. We did provide our population with MNCOR-made barrier masks, and depending upon the status of COVID in those facilities, surgical masks were used throughout the course of this, and each facility would manage the supplies of those masks going forward. We did make mask use a requirement for staff as well as people in the population. This was done by asking facility leadership to make rounds on each shift and to ensure compliance. We did receive complaints about some of this, both from people in the population as well as staff as it related to the compliance on both sides, those we are in our custody and those that are in our staff. We also did some video audits to assess compliance. This was not about discipline, but it was about trying to assess compliance. And our later compliance checks, we found that there was high levels of compliance with mask wear when we randomly conducted those. Staff and inmates are tested, following some guidance we received from MDH. If more than 2 cases of COVID are present in the facility, we would do sentinel or facility-wide testing. And as I mentioned, as of January 6th, we've done about 87,000 tests of our incarcerated population. We're the 4th highest number of COVID tests administered in the country. And that has been immensely helpful. The tests are always supervised by those team members, the testing strike force, which gets sent out across the DOC, and they are specially trained DOC staff. For the sharing of information, these were some of the questions that came from the committee members. For staff, that information only goes to Human Resources, who does a notification if a person tests positive, and that information gets shared. For members of the population, it gets documented in the medical record, and we are in that process of implementing. Senator Limmer will be glad to hear this, our electronic medical record system, which was a huge thing over the course of the last few sessions, and we're grateful to see that finally coming to fruition. We have had some issues of people refusing to be tested, but that has been infrequent. For people in our population who have refused, they are treated as though they are positive, and they are put into isolation status for that 14 days. Mandatory testing is mandatory for both staff and members of the population. To date, we've spent a considerable amount of money on testing. The actual expenditures have been about just over $1 million, but we do know that we have outstanding invoices, and we believe that when all is said, through the end of December, we've incurred expenses of about $3.5 million on the testing of DOC staff. The population testing is paid for as through the SEOC and the testing task force at the SEOC, and so it is not billed, and that would there would be a separate request for those funds through the CRF. There was a question about how long people were in, and this was one of the areas of key concern for us. We obviously are concerned that in many cases we've had to curtail industry jobs and recreation. We tried to minimize that as much as possible, but we did do things, as I mentioned, like making sure that we provided some free phone calls to people, each person with 2 a week. We implemented the stay with unit plans, where when you were in a housing unit, you would stay with those people, and we increased the number of video visits. Since the start of this pandemic, the incarcerated population, more than 500,000, more than 550,000 free 5-minute phone calls to family, friends, and loved ones. And we think that that's remarkable and something that really is important to their well-being over the long haul. As outbreaks occurred, we had behavioral health staff do check-ins with both staff and our population to make sure that we were responding to people as needed. We do have a DOC kind of support group, a support team that does staff support when outbreaks occurred, which was really important. And we had some very close calls and very serious illnesses on the part of DOC staff during the course of this pandemic, and fortunately, no loss of life, knock on wood. And we continued our treatment and education services, although they were often modified. Vaccine distribution, we do not have a final decision on this yet. We're talking to some of the other states. We will follow the guidance of the CDC and MDH. We have started the vaccinations of healthcare staff that are largely have started and implemented. And as you may have read, we started doing vaccinations of our population, which would be considered the nursing home level care folks at the transitional care unit at Oak Park Heights. These are for men that are oftentimes in acute medical conditions. Our Linden unit, which is geriatric males at the Faribault facility, and a small group of women at the Monaghan unit at Shakopee, who fit in either of the acute medical or geriatric areas. Our vaccine rollout our DOC staff are prioritized as first responders, and as you know, that is beginning and with paramedics and so forth across our state, and that will continue to roll out as supply chain allows. We would say that we do regard the vaccination, even of the members of our population, as fundamentally a public health issue, and not so much as a correctional or criminal justice issue. I know that there has been attention given to, whether people who are in prisons or correctional settings should be given the vaccine or when they should be provided them. But I think if you think about this as a public health matter and being in congregate care, both for the well-being of the people who are incarcerated as well as our staff, a public health approach really becomes critical and important. The supply chain will certainly influence the speed with which we can get the vaccine out, and we need to continue educating both staff and people in the population. We talked a little bit about this earlier, but there is a backlog of cases in the courts. We think somewhere around 10,000 additional cases, or slightly more than that, are pending or in the hopper, so to speak. But we think as the courts reopen, we do not believe it will create this crush and create a population capacity crisis for the agency. Remember that the average person who comes into the DOC, on average, we spend about 31 months in DOC custody, and then followed by a period of supervision. As we look at what's our plan to manage COVID as the population, we certainly believe that vaccine rollout will help us on this front. Along with, and we know this will be key and critical for all of us, both in the community as well as in the correctional setting, is the use of all of the prevention strategies, social distancing to the extent that's possible, mask use, and hygiene practices. The question was asked, what are some of the policies that we would be looking to make permanent going forward? And I think, I think there's a number of things that we think are really important, and ultimately would like to be able to talk with the committees about this. We were taught many lessons by COVID, about the pandemic response in general. We learned a lot of things about our infrastructure, our air handling systems, for instance, the age of our facilities, the extent to which, open front doors, cell doors, or, barred cell fronts versus the newer facilities have solid doors with windows and pass-through slots. And the ability to do containment really makes a big difference in terms of how these facilities are built. We need to continue our ongoing use of these stepped-up hygiene practices. And I think ultimately we look forward to discussing with the committee double bunking strategies in our facilities, especially those that were not intended to be double bunked. And we did not get a chance to talk about it last year, but the OLA did a report on safety last year, which was issued in the state's correctional facilities, and the double bunking issue, especially in some of our older facilities and those not built for it, was one of the issues that had come up. And so with that, Mr. Chair and committee members, I would for any questions that the committee may have or you'd like to. Again, I brushed through as quickly as possible to give both some background and answer those questions, and look forward to answering your questions.
Well, thank you, Commissioner. Anyone have, oh, we've got a lot of hands up. I think we'll start with Senator Bigum.
Thank you, Mr. Chair. Thank you, Commissioner. Good to see you. Been thinking of you and your staff and all your jobs that you have to do during this trying time. Just a couple questions. One, of the 302 incarcerated people that were granted early release, and you did lay out some criterion of kind of what you used to grant that. Were they just done then, or was there any community supervised participation from our county partners in that?
Commissioner Schnell.
Mr. Chair, Senator Bingham, yes, there was supervision. Again, either by DOC personnel, if they were on COVID work release, that DOC administers the COVID work release or work release programs. If it was conditional medical release, yes, the counties picked up the supervision of that, and we provided some pass-through funding with CRF dollars.
Follow up, Senator Bingham.
Yep, thank you, Mr. Chair. That should kind of be noted as a budget discussion too, then, not maybe for our committee, but when we do talk about the community corrections funding, that's a big deal when it comes to counties. Then just two general questions. One, are you in conversations with the courts though about when they get going, like that you're going to collaborate and make sure that they're going to have a backlog as it's been noted? So, I mean, at least are you having conversation to be prepared? And then the other one is, how are your staffing numbers going?
Commissioner Snell.
Mr. Chair, Senator Bingham, yes, we are talking with the courts and know that these backlogs exist. Certainly the county attorneys are very much aware. We'll be interested in seeing how this backlog gets processed. It certainly will create some challenges for the courts as this goes forward. And I know many sheriffs are struggling with it already, as some courts are in operation. But yes, we are coordinating on that front. And then I would just say on the staffing front, staffing, you may have seen that because of some budget issues, we did talk earlier on about some potential closures, which funding came through during the special sessions of Togo and Willow River. So we were looking at how we manage staff and wanting to be able to move as many staff as would be interested in accepting transfers. That was not in the end necessary, but staffing is an issue, although we're seeing our numbers have dramatically improved in terms of people applying and even bringing people in has been better. But there's a few of our facilities that we're challenged, mostly by COVID. Has been one of the big challenges, but we will be doing and really seek to ramp up our hiring as we go forward.
All right. Senator Ingebrigtsen.
Thank you, Mr. Chair, and thank you, Commissioner, for the report. I've got a couple questions. When you do the public release, you're doing these early releases over COVID. I think generally speaking, people probably don't understand that. And I guess I'm wondering, do you have or are you required to have any public meetings or public input on this? When you talk about early releasing 302, I think it was, or 320, do you have any public meetings at all about that, or you just do that by rule, or what authority? And I'm sure you can answer that for me. And then I have one more.
Commissioner Schnell.
Mr. Chair, Senator Ingebrigtsen, the authority for that, there is not public input. We work obviously with our partners across the system, but the authority for that really comes in Minnesota law. And work release has been long used as a program, as I mentioned. We did some modification where we did monitoring of people at home during that period of time. And conditional medical release has also long been used, and we used a very complex process out of that. As I mentioned, out of that 2,800 people who applied for conditional medical release, about 150, just over 150 were approved. And then again, this is all subject to supervision when people are out in the community.
Sure.
Senator Ingebrigtsen.
Thank you, Mr. Chair. And I would, of the 900 you said in Shakopee, just like that overnight happened, and what a thing that must have been to try and manage. Can you tell me how many of those folks ended up dying at all, or you didn't report that at all, or how many of the expired inmates have we had over this COVID?
Commissioner Schnell.
Mr. Chair, Senator Ingebrigtsen, we've had 11 deaths. Last night, late last night, we had our 11th death. The vast majority of those deaths have occurred out of the Faribault facility. Why there, specifically, I can't say, but deaths out of Moose Lake, Shakopee, and I'm sorry, Shakopee has not any deaths. Stillwater and Moose Lake, Stillwater, and Faribault are the three facilities where deaths have occurred. We do have at least 2 other people right now that are in very critical condition, one that we do not expect to survive.
Okay. Thank you for that. And one more follow-up. Just with that, just finalized, and you'll probably report this to us later, of those that have died, unfortunately, what's the age there? Are we talking the older ones? Have you got an age at all on that?
Commissioner Schnell.
Senator Lemers, Chair Lemers, Senator Ingebrigtsen, the ages have really run the gamut. Youngest being in his, I think his 30s. Again, generally speaking, with some medical history. And then the vast majority of in the 50s, 60s, 70s age range is where most of them have landed. And again, these are people who, generally speaking, have had some level of pretty significant underlying.
Thank you, Commissioner.
Thank you, Senator Ingebrigtsen. I'll move on to Senator Kiffmeyer, followed by Senator Latz.
Thank you, Mr. Chair. I appreciate this information, and having served on HHS for probably 12, 13, 14 years or so, this is kind of touching a little bit on the area. So my question for you in regards to I have a few of them, and I might maybe just list them and then let you just answer them. So one is on the 11 deaths. It says COVID related. So frequently in our general population overall, as you kind of intimated that this might have been also comorbidities or age related. If you could just kind of clarify that just a little bit. And on those 11 deaths, how does that compare to other years? Have you had deaths in other years in the prison population? What might those have been? And I think one of the other questions I have is in regards to the vaccine. It's become apparent, especially in my district, I'm getting calls from people that their family members in nursing homes and other places are not getting the vaccine. And so I know that's a real challenge because we want to take care of everybody as best we can. A question I have for you, in the prisons, will there be the same priority as somebody who's out of prison? In other words, we know that the COVID-19 particularly goes after the elderly. And so I noticed that in any state, no matter where you are, the order of vaccination has largely been to the most elderly and working way down in age, and then also those who may have comorbidities or vulnerabilities. If you could just address those few things, I'd appreciate it. Thank you.
Commissioner Schnell.
Mr. Chair, Senator Kiffmeyer, yes. Frequently, when we say COVID related, that that oftentimes COVID is certainly a factor that may have worsened or intensified other medical conditions, and so frequently comorbidity is a factor. as we look at deaths in our system, at any given year, we have a number of deaths. We generally run, what was the number about?
Last year we had 8.
So 8 between, I just asked Nan here, it was it's about a dozen or less. It would be a typical year. And so that would be the standard that we would see. Now, again, what the numbers that were, these 11 that we're reporting were people who were confirmed as having COVID and had COVID of their death, which is different than somebody who had other deaths in the system. People who have had cancer, as a for instance, who have died while they've been in our custody, and those are not part of that 11. And then finally, on the vaccine front, I would just say that yes, we are following a more of a traditional community standard, and so yes, there will be some work to be done in terms of how that gets distributed, and even our health services has looked at people both age factors as well as underlying medical conditions and determining those whose medical conditions are most significant or severe.
Sarah Kiffmeyer, any other questions?
No, thank you, Mr. Chair. I may have other questions, but right now that nicely answered what I did have. Thank you, Commissioner Schnell.
All right, Senator Latz. You have to unmute, Senator Latz.
Mr. Chairman, I was pressing the space bar like you suggested, and it did not work.
We'll blame Angela for that faulty instruction.
Mr. Chairman, Commissioner, could you talk a little bit more about the Office of the Legislative Auditor's recommendations, what you've done in response to them and how they have dovetailed into the COVID-19 matter?
Commissioner.
Mr. Chair, Senator Latz, yes, I think, one of the things that there was many, I think, learnings that came out of the report, and that really dovetailed, into our COVID response. And some of this was really, we had to make sure that we looked at safety and security, and ensuring that safety was paramount. Some of the things in the OLA report, as a for instance, really looked at some of our facilities, in particular our older facilities that where we've had some of the most significant or serious staff assault issues, and said, and the OLA really looked at recommending the extent that possible of how do we look at the physical structures of these facilities and what that may mean from a staff safety standpoint. And then again, we laid on top of that this whole question about the issue of construction and how it is that we manage infectious disease in these settings. And oftentimes some of the same challenges exist in these facilities, as I talked about, open front cells versus more solid doors, and so forth, were things that we talked about. Our ability and need to be responsive to the needs of our staff was something that came up, making sure that we are addressing those needs in ways that ultimately improve the morale, that we're really looking at data and using data to drive decisions. That was one of the really key findings that the OLA had, was that oftentimes the DOC is what you might say is data rich, but information poor. We have lots and lots of data, but the ability to put that and use that information to guide and drive decision making was in many cases challenged. And during COVID, we really focused heavily and are committed to continuing that focus of saying we want to build information systems that are as real time as possible, that allow us to make decisions. We did some partnering and looking at with even the Department of Navy. They have a segment that does some disease modeling. We did some work with them just because they were interested in trying to see if their modeling of ship transmission of disease was similar in correctional settings. And so there was a lot of ways in which there is overlap. And we have, as we look at our strategic plan going forward and some of the issues we have going into the future, the OLA findings really are in part one of the things that is informing and driving our strategic efforts going forward. And part of that population management and so forth.
Senator Latz, any further questions?
Well, just Mr. Chairman, I know the OLA report came out after we went into session shutdown last spring. And at some point, I think it might be worth taking a deeper dive into the OLA report and find out what recommendations can be dealt with without budgetary impact, and some that may need some budget attention as well for the safety, obviously, not only of the inmates, but of the staff as well.
Good idea. Thank you, Senator Latz. Senator Matthews.
Thank you, Mr. Chair. I would like to ask Commissioner another follow-up on the vaccination of your population issues that you alluded to, because we don't deny at all your public health argument that you bring up, but people in nursing homes, our communities outside, and all of our districts also point to that as a reason for trying to get the vaccine distributed across our communities as fast as possible. And I know that's a tension that we're trying to figure out. But I want to ask if you'd opine on that a little more. And then I'd also like to ask about who is making the decisions with this. We're using stage categorizations at this point, stage 1A, 1B, 1C, et cetera. Are the DOC staff and the populations on a stage, and who will decide what stage they're in? Is that all the Department of Health? Is that all your purview? Are you having any attempt to, are you being asked for your input, or are you attempting to influence what input that may be? If you could give me advice or an answer on who's making the decisions and why, and what kind of influence you're trying to have on that.
Commissioner Snell.
Mr. Chair, Senator Matthews, I would just say that, you know, as we look at the vaccination of the population, we share the same concerns. Obviously, we want to get this out across our state, not just at the Department of Corrections, obviously people in our communities. And I would just say that as we think about COVID response and vaccine, the vaccination of the population is both a staff safety as well as population safety issue. And as you know, we are following the protocols that are put in place, as you mentioned, the 1A healthcare providers, and then those people in what would be considered nursing home level care, and that's where distribution has been to date in the Department of Corrections. We know that the DOC staff are part of that 1B, the first responder level, and will be a part of that, which is staged. But what, I think as you talk about this, the notion of, how do we do this, and what becomes important is how do we make sure that we are fulfilling our obligation to ensure to the fullest extent possible health and well-being of our population, those people who don't have options or the ability to make independent decisions about protecting themselves from COVID. And two, I think recognizing the fact that that we have there's a sympathetic relationship that exists between our staff and the people that are in our population. And so obviously we want to make sure that the distribution of vaccine addresses both, so that we don't put our staff at a greater risk, or their families than these people have. And I'm so proud and honored to see the work that these people did, even when 900 plus people were positive and inside of our facilities. We had DOC staff that were diligent in showing up and doing and fulfilling their obligations and service to our state by showing up in those facilities. And so vaccinations is really about the health and well-being of both. And I think this is one of the challenge. I certainly want to make sure that as distribution happens, that we're addressing those categories. And I'm confident that health is looking at and working on making sure that distribution is equitable across our state as wholly as possible. With regard to the question about advocacy, we certainly ultimately that decision gets made by the Department of Health. Input from CDC and the conversation I had just this past Saturday with DOC directors across the Midwest. Some states are in exactly the same place we are, where they're seeing distribution at different points, with some states having not made decisions yet, like ours, in terms of where people in the correctional population will land relative to the staging and prioritization schedules. Some have made those decisions. And certainly what we want to do is make sure that as we think about the vaccinations, we don't want to have our people above anybody else, obviously, but at the same time, we want to recognize the fact that when people get sick and end up hospitalized, that comes at significant cost to our system. Both in our staff, certainly, but even in particular those incarcerated people. I can't tell you the number of people that we have airlifted out of Faribault, for instance, which is a medical protocol that the hospital, District 1 hospital down there, has demanded in some of those cases where acuity of care was required, the immediacy of that type of a transport. And these come at cost to us. And so there is both certainly a business side of this, and there's absolutely a human side for both staff and people in our population.
Senator Matthews, any further questions?
Yes, Mr. Chair, quick follow-up. So I'm hearing that you likely foresee not necessarily a specific designation for your population, but that they would mirror what stage they would be in society should be mirrored inside your population. Would that be an accurate characterization?
Commissioner Schnell.
Mr. Chair, Senator Matthews, I think that certainly is one of those considerations. I think that when you look at, we have to recognize the fact that we are in a congregate setting. We do nationally. People that are in correctional settings are about 5.5 times more likely than people in the general population to contract COVID. And certainly we have seen a slightly higher uptick, and depending upon the facility in Minnesota system than the general population. And so I think ultimately we want to take our guidance based upon what the data tells us. And that means that, especially for the health of our and safety of our staff who are going into the facilities every day, some states have done it where they're trying to match that as much as possible. Again, staging people based upon need and risk and age and all those other factors, but generally trying to do population at a similar time as staff, so that there isn't a problem from the standpoint of furthering infection and spread. And we'll see where that lands here. But again, we're not trying to put people above. We're just trying to, how do we best manage the public health risks that exist in these particularly strange congregate living settings that prisons and jails represent.
Any other questions? Senator Matthews, I might want to add, especially for the benefit of the public that might be listening to this, when our courts remove someone from society due to their criminal activity and place them in a cell, the state becomes not only the keeper of that individual, but we also have to provide the health protocols for that very same person. We're obligated under law to do that. And I know that it might be easy to assume that some prisoners might be getting ahead of a line of someone on the outside, but the department, I think, is correct in analyzing that they have a very closed community, and with open doors and air systems that are circulating air, it becomes a very unique petri dish when you're dealing with an epidemic or a pandemic in those very same settings. And so it's important to remind the public of that, I think. On one hand, we do to court order, we remove violent people and put them in a cell. We remove them from society, but we're really putting them in a mini society all of their own, and their health becomes our responsibility. And we're always dealing with that, and especially when there's new treatments that come out. Sometimes they're very expensive, and we have to go through that same debate all the time of whether or not and how fast do we respond to that new available treatment, or is it even available? It might be on the edge of becoming available, but it's not even available to all of the general public as well. So it's something just to keep in the back of our minds. Are there any other questions by our members? I know we're coming down to the last few minutes. Senator Matthews, you had one more?
Yes, thank you, Mr. Chair, and thank you for that reminder. And I did not want my comments to be taken that I was insinuating. Otherwise, I thank you for that reminder. I did find the commissioner's answers satisfactory just as to where we're at in this stage and how these decisions are being made. So just wanted to clarify, and thank you for the reminder.
All right. Well, Commissioner, I want to thank you for spending a time with us, reviewing these questions. I'm sure in the next 4 to 5 months, we'll have a few more for you. And I did have 2 questions that our members did not cover. During those that were released early in supervised release, were there any deaths due to COVID during the time when that individual might be outside of prison walls? And was that included in your numbers?
Mr. Chair, thank you for that. There was no deaths of people who were granted early release. In fact, our numbers of positives were quite low among them.
And then also, were there any violations of supervised release of those 300 plus individuals that were released, and did anyone have to come back?
Mr. Chair, yes, the answer to that is yes. Unfortunately, this is one of the realities. We have had a couple of people abscond, where they went to a halfway house and took off, or which is not uncommon for some of our population, despite the fact that we focused on generally those that were of lower risk. And we had several people who were brought back. And will be spending the remainder of their time inside. But again, on the COVID work release, those people were within 90 days of their regular supervised release date anyway. But some of them did come back and may suffer some discipline as a result of that, including the potential of extended incarceration. Short periods of time where they into their supervised release term where they remain inside as a consequence.
All right. Thank you, Commissioner.
Thank you.
We're at the end of our time, and if there's no further comment, we will stand adjourned. Thank you all.